Hello and welcome to Learning English Pro. My name is Jer and today I'm here to help you learn 100 essential English phrases for beginner nurses. If you're a new nurse or nursing student, especially if English is not your first language, this lesson will boost your confidence in speaking with patients and co-workers. Being a nurse is challenging, but you're not alone. I've got your back with practical phrases you can start using right away to make your job easier and your patients more comfortable. I've organized these 100 phrases into 10 useful categories, each with 10 simple phrases. We'll cover everything from greetings and daily care to talking with doctors. For each phrase, I'll speak slowly and you'll hear each phrase twice. By the end of this video, you'll have a toolkit of kind, professional phrases to use in common nursing situations. And if you want to learn even more about each phrase, I've created a guide especially for this lesson. The guide includes all 100 phrases with extra examples and tips, and you can get it for $4.99 on my YouTube store. Or if you're one of my student members, you can download it for free as part of your membership. The guide includes a glossary and 2 additional exercises to really boost your knowledge around this area of medical English for nurses. And when this lesson ends, don't go anywhere because this video also includes my Medical English Masterclass for beginners to help you put these phrases into practice. Check the video description for timestamps so you can find each section and revisit the masterclass anytime. So after all that business, let's get right to it. And our first category for our Nurse Beginners English is greetings and introductions. Remember, I'll say each phrase twice and give you space to say it too. First impressions matter in nursing. Use these phrases to greet patients politely and start building trust from the very first hello. Hello, my name is Jer. I'll be your nurse today. Hello, my name is Jer. I'll be your nurse today. How are you feeling today? How are you feeling today? It's nice to meet you. It's nice to meet you. Good morning. Good morning. I will take good care of you. I will take good care of you. Let me know if you need anything. Let me know if you need anything. Are you comfortable? Are you comfortable? Did you sleep well? Did you sleep well? How can I help you? How can I help you? Do you have any questions? Do you have any questions? Great job! Which greeting or introduction phrase did you find the most useful? Let me know in the comments below. And remember, all the phrases and more are in the downloadable guide, so grab it if you need a handy reference. Now, let's move on to our next section, where we talk about something every patient cares about: food and meal times. Eating well is important for recovery. These phrases will help you talk to patients about meals, drinks, and dietary needs in simple English. Are you hungry? Are you hungry? It's time for breakfast. It's time for breakfast. Would you like something to eat? Would you like something to eat? Do you need help eating? Do you need help eating? I'll bring your food now. I'll bring your food now. Would you like some water or juice? Would you like some water or juice? How is the food? How is the food? Are you thirsty? Are you thirsty? Are you on a special diet? Are you on a special diet? Would you like some more food? Would you like some more food? Excellent. Now a quick quiz. If a patient has trouble feeding themselves, which phrase from this section could you use to offer help? Think about it. Yes, it's this one. Do you need help eating? It is the perfect phrase in this situation. Great work if you got that right. If you're finding this lesson useful, why not share it with a colleague and practice these phrases together? And don't forget to like and subscribe. Next, let's move on to personal care. Patients often need help with personal care. Here are 10 simple phrases to help you assist with using the bathroom, keeping clean, and staying comfortable, all while being respectful and gentle. Do you need to use the bathroom? Do you need to use the bathroom? I can help you to the bathroom. I can help you to the bathroom. The bathroom is over here. The bathroom is over here. Let me help you wash your hands. Let me help you wash your hands. It's time to change your clothes. It's time to change your clothes. I will help you take a shower. I will help you take a shower. Let's get you cleaned up. Let's get you cleaned up. Do you need help brushing your teeth? Do you need help brushing your teeth? I'll bring you a clean gown. I'll bring you a clean gown. I will close the curtain for you. I will close the curtain for you. Great job! Which of these personal care phrases do you think you'll use the most in your daily work? Share your thoughts in the comments. For example, many nurses frequently say, "Do you need to use the bathroom?" throughout their shift. If you haven't yet, download the guide to review all these phrases later. Now, let's continue to an important clinical part of nursing: vital signs and monitoring. Nurses check vital signs to monitor a patient's health. These phrases will help you explain and carry out blood pressure checks, temperature readings, and other monitoring tasks clearly and calmly. I need to check your blood pressure. I need to check your blood pressure. I need to take your temperature. I need to take your temperature. I will check your pulse. I will check your pulse. Let me check your oxygen level. Let me check your oxygen level. Please breathe normally. Please breathe normally. Take a deep breath. Take a deep breath. Hold still, please. Hold still, please. Roll up your sleeve, please. Roll up your sleeve, please. Relax your arm. Relax your arm. Your blood pressure is normal. Your blood pressure is normal. Awesome, you're doing so well. Let's have a pop quiz. What phrase would you use to instruct a patient to take a big inhalation while you listen to their lungs? Got it? Yes, it's take a deep breath. Excellent. Keep practicing these phrases so they become second nature. Remember, all these sections are part of my Medical English Masterclass that's coming right up after these 100 phrases. It's full of lots of individual medical English lessons, and they're all timestamped in the video description so you can navigate to the lesson of your choice. Next up, we'll cover phrases for pain and discomfort, an area where clear communication is very important. With this section, keeping your language simple and soothing will encourage patients to communicate their needs. Are you in pain? Are you in pain? Where does it hurt? Where does it hurt? Does it hurt here? Does it hurt here? Does it hurt when you move? Does it hurt when you move? How bad is the pain? How bad is the pain? Let me know if it hurts. Let me know if it hurts. I'll give you something for the pain. I'll give you something for the pain. I will help you get comfortable. I will help you get comfortable. Do you feel better now? Do you feel better now? Tell me if it gets worse. Tell me if it gets worse. You're doing so well. Pain management is really crucial. Which phrase from this section do you think is the most important to remember? Personally, I think how bad is the pain is pretty essential because understanding pain level helps decide what to do next. If you have a different favorite phrase, share it in the comments. And remember, these phrases are all in the downloadable guide with extra explanations. Now let's continue to section 6, which is all about safety and movement. Patients might be unsteady or confused, so nurses often need to give simple instructions to keep them safe. These 10 phrases will help you encourage safety and assist patients with moving around. Please be careful. Please be careful. Don't get up alone. Don't get up alone. Use the call button if you need help. Use the call button if you need help. I will help you walk. I will help you walk. Hold on to the railing. Hold on to the railing. The floor is slippery. The floor is slippery. Move slowly, please. Move slowly, please. Please sit down. Please sit down. Wait for me to help you. Wait for me to help you. Watch your step. Watch your step. Fantastic, that's another 10 phrases under your belt. Safety is key, and you now have some clear, polite commands to use with your patients. Try to imagine using these phrases during your day. For example, when transferring a patient from a bed to a wheelchair, you might say, "Don't get up alone. Wait for me. I will help you." See how these phrases can work together? If you have a scenario in mind, feel free to write it in the comments using some of the safety phrases. It's a great way to practice. And a quick reminder, if you're finding this video helpful, consider becoming a Learning English Pro student member. Members get access to all my lesson guides, including the one for this video, and lots of extra practice materials. Now, let's keep up the momentum and move on to Section 7, Emotional Support and Reassurance. Hospital stays can be scary or stressful. As a nurse, your words can comfort and reassure patients. Here are 10 simple phrases to offer emotional support and empathy when patients feel anxious, afraid, or sad. You are doing great. You are doing great. Everything will be okay. Everything will be okay. You are in good hands. You are in good hands. We are here for you. We are here for you. You are not alone. You are not alone. Don't worry, we will take care of you. Don't worry, we will take care of you. I understand how you feel. I understand how you feel. It's normal to feel this way. It's normal to feel this way. Let's take it one step at a time. Let's take it one step at a time. Do you want to talk about it? Do you want to talk about it? Wonderful, great job. Being a nurse isn't just about medical tasks, it's also about caring. Using phrases like these can really comfort your patients. Let's have a quick question. If a patient says, "I'm scared about my surgery," what could you reply? There are a few options here, but a good one is, "It's normal to feel this way." You are in good hands. See how we combined two reassuring phrases. Keep these in mind. They truly make a difference. We're almost there, just a few sections left. For Section 8, let's quickly cover some general instructions nurses often give to patients. These don't neatly fit into other categories, but they're very useful. You'll use these all the time for various procedures and tasks. Please lie down. Please lie down. Please sit up. Please sit up. Please turn on your side. Please turn on your side. Open your mouth, please. Open your mouth, please. Take this pill. Take this pill. Drink some water. Drink some water. Stand up, please. Stand up, please. Follow me, please. Follow me, please. Wait here, please. Wait here, please. One moment, please. One moment, please. Great work on those general instructions. These are everyday phrases that will come in handy in countless situations. Remember to always say please. It makes a big difference in how your instructions feel to the patient. We only have 2 categories left. Now let's change perspective. The next set of phrases is about talking to other nurses. Communication with your team is just as important as communication with patients. So let's dive in. Can you help me? Can you help me? I need help with this patient. I need help with this patient. We have a new patient in room 5. We have a new patient in room 5. Room 5 needs a blood test. Room 5 needs a blood test. Did you give the morning medication? Did you give the morning medication? The patient in room 5 has a fever. The patient in room 5 has a fever. Can you check on the patient? Can you check on the patient? Let's start the handover. Let's start the handover. I finished checking on the patients. I finished checking on the patients. I'll take a break now. I'll take a break now. Good communication with your co-workers keeps the ward running smoothly. Try to use clear and short phrases like these so everyone else understands. Leave a comment if you have other useful nurse-to-nurse phrases in mind or if you've already been using some of these. We're almost at the finish line, just one more category to go. Our final section will focus on talking to doctors. These phrases will help you communicate important information to physicians clearly and respectfully. Let's finish strong. The patient is in pain. The patient is in pain. Her blood pressure is low. Her blood pressure is low. He has chest pain. He has chest pain. She is having trouble breathing. She is having trouble breathing. He needs more pain medication. He needs more pain medication. The patient is asking for you. The patient is asking for you. Do you have any new orders? Do you have any new orders? The test results are back. The test results are back. I have a question about the patient. I have a question about the patient. The patient is getting worse. The patient is getting worse. You did it. You've learned 100 English phrases for beginner nurses. That was a lot of content, so well done for sticking with me to the end. Give yourself a round of applause. We've covered 100 phrases across 10 different topics, from giving a friendly greeting to ensuring patient safety to collaborating with your team. These phrases are your building blocks for effective communication in a hospital setting. Don't forget to download the accompanying guide for this video. It's a great way to review all the phrases and keep them handy. It's available for $4.99 or for student members as part of your membership. Also coming right up is my Medical English for Beginners Masterclass, full of lots of additional medical English for you. Thank you so much for watching, and I'll see you in the next lesson. Hello, this is Learning English Pro. My name is Jer. I'm your online tutor and guide. Welcome to the Ultimate Beginner's Guide to Medical English, where we unlock the essentials of healthcare communication, starting with today's lesson on basic medical terminology. But that's just the beginning. I've carefully crafted a series of 10 additional lessons covering everything from hospital vocabulary to first aid in English, ensuring you're fully equipped to navigate the medical world with confidence. So after this lesson, stay tuned for all of those additional lessons. Whether you're aspiring to work in healthcare or simply aiming to enhance your English for personal knowledge, these lessons will pave the way for your mastery in medical English. So if you're ready, let's dive into our first topic of basic medical terminology. And firstly, we're going to look at the human body and explore 6 major body systems. Understanding these systems is crucial for anyone looking to master medical English. And for each term in today's lesson, I'll introduce a useful phrase that you might encounter or use in a medical context. The cardiovascular system is a system which circulates blood throughout the body, delivering oxygen and nutrients to tissues. Cardiovascular system. Let's take a look at our example phrase. The patient's cardiovascular system is healthy with no signs of heart disease. Let's move on to our next body system, which is the respiratory system. Repeat after me. Respiratory system. The respiratory system comprises of the lungs and airways. This system is responsible for breathing and gas exchange. She is experiencing difficulty breathing, indicating a possible respiratory system issue. The digestive system is the system which breaks down food into nutrients, which the body uses for energy, growth, and cell repair. Digestive system. Our example phrase is, gastrointestinal symptoms suggest a problem within the digestive system. Next up, we have the nervous system. This system controls both voluntary actions like walking and involuntary actions like breathing. Nervous system. After the accident, we're monitoring him for any signs of nervous system damage. The musculoskeletal system provides support and movement with bones, muscles, tendons, and ligaments. Musculoskeletal system. Let's check out our example phrase. The X-ray shows a fracture in the arm affecting the musculoskeletal system. Our final body system for this segment is the immune system. This system defends against pathogens and disease. Immune system. A weakened immune system can lead to frequent infections. Now that we've covered the body systems, let's move on to understanding common symptoms. This knowledge will help you describe and understand medical conditions more effectively. A fever is an elevated body temperature, typically a sign of infection or illness. Fever. Our example sentence is, Gemma has had a fever for the past few hours. Let's move on to nausea. Repeat after me. Nausea. This is a feeling of unease in the stomach that often comes before vomiting. She started to feel some nausea this morning. Let's move on to headache. A headache is pain or discomfort in the head, scalp, or neck, ranging from mild to severe. Vincent started to get a headache this morning in the library. Our next symptom is dizziness. Dizziness. This is a sensation of spinning or losing one's balance, often linked to inner ear issues or low blood pressure. Let's check out our example phrase. Ming lay down as she was experiencing some dizziness. Fatigue is an overwhelming sense of tiredness or lack of energy, not relieved by rest or sleep. Fatigue. Kate has suffered with extreme fatigue since she had a virus. Next up, we have cough. Repeat after me. Cough. A cough is where we expel air from the lungs with a sudden sharp sound. One of the symptoms Edward had was a bad cough. Navigating the medical world involves interacting with various healthcare professionals, and each plays a unique role in ensuring your health and well-being. Let's explore some of these professions, providing a brief definition and useful phrase for each. First up is a GP or a general practitioner. This is a medical doctor who can diagnose and treat a wide range of common illnesses and health issues. Let's check out our example phrase. You should see a general practitioner if you're experiencing unexplained symptoms like persistent headaches or fatigue. Our next healthcare professional is a nurse. Nurses provide care and support to patients in various settings, assisting with medical procedures and patient education. The nurse will take your vital signs and update your health records before you see the doctor. A pharmacist is an expert in medication. They are responsible for dispensing prescriptions and advising on their safe use. Ask your pharmacist if this medication has any potential interactions with what you're currently taking. A surgeon is a doctor who can perform operations to treat diseases, injuries, or deformities. Let's check out our phrase. The surgeon explained the risks and benefits of the procedure during the consultation. There are lots of types of healthcare professionals. Let's cover one more. A dermatologist. Dermatologists specialize in treating conditions relating to skin, hair, and nails. For persistent skin rashes or acne, you should consult a dermatologist for specialized care. Armed with knowledge about healthcare professionals, it's time to tackle what comes next, treatments and procedures. We're diving into essentials that keep the medical world turning. A prescription is a doctor's order for the preparation and administration of a drug or device for a patient. Our example phrase is, "This prescription should help alleviate your symptoms within a few days." Our next medical treatment is a vaccination. This is the administration of a vaccine to help the immune system develop protection from a disease. Vaccinations are crucial for preventing infectious diseases. A surgery is a medical procedure involving an incision with instruments performed to repair damage or arrest disease in a living body. The surgery is scheduled to remove the benign tumor. Physical therapy is a treatment method that uses physical techniques to relieve pain, improve mobility, and restore physical function. Our example phrase is, "Physical therapy is recommended to recover from the knee injury." Chemotherapy is the use of chemical substances, especially drugs, to treat diseases like cancer by killing or stopping the growth of cancerous cells. Chemotherapy is a common treatment for various types of cancer. A biopsy is the removal of cells or tissues for examination under a microscope to check for illness or disease. A biopsy will be performed to examine the tissue for signs of disease. It's really essential to be prepared for unexpected situations. Moving forward, we're about to explore emergency phrases that are crucial in urgent healthcare settings. Let's get ready to learn how to express urgent medical needs clearly and concisely. I need an ambulance. We would use this phrase in a life-threatening situation that requires immediate medical attention. I need an ambulance. It's an emergency. He's having trouble breathing. This phrase alerts medical personnel to the urgency and nature of the medical crisis. It's an emergency. He's having trouble breathing. I'm allergic to penicillin. It's vital to communicate allergies to avoid adverse reactions in emergency treatment. I'm allergic to penicillin. She's unconscious. This phrase indicates a serious condition requiring urgent medical evaluation. She's unconscious. There's been an accident. You can use this phrase to report incidents requiring emergency medical services. There's been an accident. I think it's a heart attack. This phrase describes symptoms that suggest a heart attack, prompting immediate action. I think it's a heart attack. And that brings this lesson on basic medical terminology to a close, but don't go anywhere. Coming right up is a lesson on hospital vocabulary. First up, let's take a look at some synonyms for the word hospital. We have medical institution, medical facility, health centre, and clinic. Reasons you might go to the hospital include surgery, therapy. You may need to go for testing or an examination. Maybe you need a consultation. A consultation is meeting with an expert. like a specialist medical doctor, in order to seek advice and receive evaluation. If you are a regular patient, you might be going for a checkup. A checkup is an appointment where a disease or illness is monitored. Maybe you are visiting someone in a hospital. In that case, you are called a visitor. Hospitals are divided up into different areas called departments or wards. If you need to find where you're going, you can always ask for help at the help desk or reception. In every ward or department, there will be a nurse's desk where you can seek further information. A lot of people will arrive in hospital because of an emergency. This is a serious, unexpected, and often dangerous situation requiring immediate medical action. And if you have a medical emergency, it's very likely that an ambulance will come to collect you and bring you to the hospital. The person on the ambulance team who initially evaluates you and checks your health is called a paramedic. And if it is required, you'll be put on a stretcher. This is a mobile bed that is used to carry patients to and from an ambulance. Next up, you are on your way to the emergency room. This is what is called in America, and sometimes it's abbreviated to ER. In other countries, it might be referred to as the emergency department or accident and emergency. Short for accident and emergency is A&E. And when you are being treated in the hospital, you are called a patient. If your treatment involves you staying in hospital, you are called an inpatient. And if you stay at home while receiving your treatment, you are an outpatient. And as an outpatient, usually you would come into the hospital by appointment for your treatment. As a newly arrived patient, you will be subject to an assessment or an examination, and this will be done by a doctor. If you want to learn different types of doctor, check out my vocabulary which covers this topic. The link is on screen and in the description below. A tool which you'll always see a doctor carrying is the stethoscope. This is primarily used to listen to a patient's heartbeat. Doctors are also known for wearing a white coat, and it is not unusual for them to be referred to as a white coat. They can often be seen wearing scrubs. These are blue or green pajama-like clothing that is worn for protection or during surgery. And during surgery, a doctor can be seen wearing a surgical gown, a face mask, protective goggles, and gloves. A very important employee of the hospital is a nurse. If you'd like to learn more words relating to nursing, check out my video on healthcare vocabulary. Nurses provide care to patients, and a big part of their job is managing the patient chart or patient file. Nurses are known for working very hard and doing lots of different tasks, some of which include taking your blood pressure and your body temperature. And more often than not, it will be a nurse who dispenses your medication to you. Synonyms of medication include medicine or drugs. Let's take a moment to look at the different ways medicine is given to you. One method uses a syringe. This is called injection. Medication can be taken orally with pills. Medication can also be given with an IV drip. This is short for intravenous drip. Common types of medication include painkillers, antibiotics, antiviral drugs, or steroids. In the hospital, you may receive a prescription from your doctor for medication. This is a signed document which you can bring to the pharmacy, and they will provide you with your medication. Next up for our hospital vocabulary, let's look at different types of scans. A scan is a testing method, and these include X-ray, along with MRI, which stands for magnetic resonance imaging. There is also the CT scan. CT stands for computerized topography. There is also the ultrasound, which is commonly used during pregnancy. Another common type of test in the hospital is a blood test. Sometimes it'll be referred to as a blood screening. For some conditions, it may be necessary to stay in hospital for a prolonged period. Sometimes this is done for observation or monitoring. Doctors do this to see how you are recovering or how your condition is progressing. If your condition is very serious, you may need to stay in the intensive care unit. And if you are having difficulty breathing, you may be put on oxygen. For some people, staying in hospital involves having surgery. This can be done for diagnosis, for biopsy, or perhaps for removal or repositioning if something is where it shouldn't be. Or perhaps it's to redirect something like blood flow. And of course, we must consider transplants. There are many other reasons for surgery. Can you think of any more? Let me know in the comments. After surgery, it's very common to get bandaging, and this is done, of course, with bandages. These can also be used for things like sprains or small cuts and abrasions. However, if you break or fracture a bone, you may need a plaster cast. This is done to reset the bone. It can simply be referred to as a cast. I got a cast on my broken arm. If you've broken a leg or have difficulty walking, you may need crutches. For someone who needs additional support while walking, they can use a Zimmer frame. This can also be called a walker. If you are unable to walk, you will need a wheelchair. A wheelchair is also commonly used to transport all patients throughout the hospital. A common reason for women to go to hospital is to give birth. This is often done in the maternity or labour ward. Generally, in big cities, there will be a maternity hospital. This type of hospital only takes care of women and their babies. Doctors may also keep you in hospital for convalescence. This means for rest and recovery. This is common after a surgery or after suffering from a serious illness or condition. And when you're ready to leave hospital, the doctor and hospital will discharge you. This is the word we use to describe when the hospital or doctor has given official authorization to release you from medical care and to return to your home. The first piece of medical equipment we'll take a look at is the crutch. Repeat after me. Crutch. When they're given as a pair, they're simply called crutches, the plural form. Our next piece of equipment is called a walker. Repeat after me. Walker. This is typically given to older people who may have mobility issues. And we also have the wheelchair. Repeat after me. Wheelchair. Next up, we have plaster cast. Plaster cast. This can also be referred to as plaster of Paris. Plaster of Paris. More advanced versions of a plaster cast would be called a synthetic cast. Synthetic cast. We also have the splint. Repeat after me. Splint. A splint involves a rigid material supporting and immobilizing a broken bone when it has been set. Common types of splint are the leg splint and finger splint. Similar to a splint, we have a support. Something like a wrist support can help with a fracture or a broken bone when it is healing. For a broken or injured foot, a support boot is often used. This can also be referred to as a brace boot. And next up, we have a brace itself, which is like a bigger version of a splint. Brace. A common version of the brace is the leg brace, but there's also lots more, such as the neck brace as shown on screen, but you can also see sometimes a back brace or even a body brace. A similar device which is used for a broken arm is called a sling. Repeat after me. sling. Let's move on to our next piece of equipment, which is bandage. Repeat after me. Bandage. There are lots of different types of bandage. This one is called a compression bandage, or sometimes it's called an elastic bandage. Next up, we have dressing. Repeat after me. Dressing. This is a sterile bandage which is applied directly onto a wound. Another type of bandage is called medical gauze. Medical gauze. This is the thin, transparent fabric which is often used along with bandages. We also have adhesive tape and cotton wool. These can be found in lots of other settings than a medical practice. Adhesive tape and cotton wool. A common type of bandage found in the home is referred to as a Band-Aid in American English, that's a trademark by the way, and as a plaster in UK English. A more general term for it would be an adhesive bandage. Lots of these types of bandages and gauzes can be found in a first aid kit. This can be a piece of medical equipment that can be found in lots of different workplaces and is useful in case of an emergency or an accident. This small medical tool is known as a swab. Repeat after me. Swab. And this is a stethoscope. Let's try it one more time. Stethoscope. For measuring a patient's temperature, we use a thermometer. Thermometer. Another test we can do for a patient is a blood test. Blood test. This is done with a syringe. Repeat after me. Syringe. It is tempting to say syringe, but it's syringe. And this part of the syringe is known as the needle. Needle. Something which is commonly found in lots of different medical settings is a vial. Repeat after me. Vial. And similar to a vial, we have a test tube. Test tube. Moving along, our next piece of equipment is called a blood pressure cuff. Blood pressure cuff. Our next piece of equipment can be known as telemetry pads or ECG electrodes. These are used to monitor important functions in a patient's body. If you've ever broken a bone, you will have had an X-ray. X-ray. This device is placed on the finger and used to measure the amount of oxygen in the blood. It's called a pulse oximeter. Pulse oximeter. To find out how heavy someone is, you would need a weighing scales. Weighing scales. Our next device is used to look at the ear and eardrum. The otoscope. Repeat after me. Otoscope. Let's move along to some more smaller tools, like the tweezers. Repeat after me. Tweezers. We also have the scalpel. Repeat after me. Scalpel. Next up, we have some scissors. Now, there's lots of different types of scissors in the medical world, but generally we can refer to them as medical scissors or surgical scissors. To provide oxygen to a patient, we use an oxygen mask. Oxygen mask. To help a patient breathe, we use a piece of equipment called a ventilator. Ventilator. And when a patient is not breathing on their own, a resuscitator can be used to help them breathe once more. Resuscitator. The type of hospital bed which moves on wheels is called a gurney. Repeat after me. Gurney. The type of bed which is used by an ambulance is sometimes referred to as a stretcher. Stretcher. Next up, we have the magnifier. Magnifier. And to help see even closer, we have a microscope. Microscope. And with some examinations, a doctor may use something like a telescope to look inside your body. Telescope. Our next device helps get medication into the lungs. Inhaler. Repeat after me. Inhaler. And the IV drip helps get medication into your bloodstream. IV, of course, stands for intravenous. Something which is commonly connected to an IV drip is a saline bag. Repeat after me. Saline bag. A blood bag is another container which is sometimes connected to an IV drip. Blood bag. The blue, green and sometimes pink outfits worn by medical personnel are known as scrubs. Scrubs. Medical personnel can also be seen wearing a surgical mask over their face at some occasions, and also a scrub cap to cover their hair. A scrub cap can also be called a skull cap. This piece of equipment is known as the examination table. Repeat after me. Examination table. And our final piece of equipment is known as a medical chair. Repeat after me. Medical chair. In this video, we will be exploring lots more English vocabulary and terms relating to healthcare and medicine. This video is perfect for anyone studying or working in any type of medicine in English. Get ready to boost your medical English knowledge with pronunciation, definitions, and lots of examples. I plan to make lots more vocabulary videos on healthcare, so if there is a specific area you wish me to cover, let me know in the comments. Don't forget to check out the extensive word list in the description. Are you ready? Sit back, relax, and let's learn some English together. Let's take a look at our first term, a runny nose. And this describes a nose that has a lot of liquid coming out of it. Let's take a look at our example sentence. We could say, Diane always has a runny nose. Diane always has a runny nose. Our next term is health hazard. And this describes something which is dangerous or a health risk. Our example sentences: the chemicals they use are a health hazard. The chemicals they use are a health hazard. Our next term is drip. As a noun, it is short for intravenous drip, a device for administering a fluid drop by drop into a vein via an intravenous or IV route. Our example sentences: can you change the patient's drip, please? Can you change the patient's drip, please? Our next term is a condition known as a chesty cough. And this describes a cough caused by congestion around the lungs. Our example sentences: Diane is suffering from a chesty cough at the moment. Diane is suffering from a chesty cough at the moment. Our next term is the word chill, and this describes a feeling of coldness. Our example sentences: Daniel caught a chill when he was out in the snow. Daniel caught a chill when he was out in the snow. The next term we will cover is cardiologist. This describes a specialist of the heart and heart activity. We could say, after his heart attack, Niall was under the care of a cardiologist. After his heart attack, Niall was under the care of a cardiologist. If you'd like to learn more English vocabulary on different types of doctors, check out my extensive video. The link for that is on screen right now. Let's move on to our next term, which is nervous breakdown. This term is sometimes used by people to describe a stressful situation in which they are temporarily unable to function normally in day-to-day life. Our example sentences: after the death of her son, Vicky had a nervous breakdown. After the death of her son, Vicky had a nervous breakdown. Our next term is the word relapse, and this word means the return of an illness. Let's take a look at our example sentence. The doctors thought David had recovered, but he suffered a relapse and is now sick again. The doctors thought David had recovered, but he suffered a relapse and is now sick again. Let's move on to our next term, which is the noun cure. This is defined as a medicine or therapy that removes disease completely or relieves pain and symptoms. Our example sentences: scientists are trying to find a cure for cancer. Scientists are trying to find a cure for cancer. If this is your first time visiting my channel, Learning English Pro, you're very welcome. My name is Jer and I'm narrating your lesson today. Make sure to subscribe to stay updated for all my latest videos. Our next term is aches and pains. This phrase describes minor pains that continue over a period of time. We could say, the patient has had some aches and pains in her stomach for a few days. The patient has had some aches and pains in her stomach for a few days. Let's move on to our next term, which is stethoscope. This is a medical instrument for listening to the action of someone's heart or breathing. I will examine the patient with my stethoscope. I will examine the patient with my stethoscope. Our next term is ambulatory. This describes something relating to or adapted for walking. Our example sentences: his treatment is focused on his ambulatory function. His treatment is focused on his ambulatory function. Our next term is NHS. This acronym stands for National Health Service, the famous publicly funded British healthcare system which was founded in 1948. Our example sentences: the NHS is having difficulty recruiting staff since Brexit. The NHS is having difficulty recruiting staff since Brexit. Next up, we have a verb, to alleviate, and this is defined as an action to make suffering, a deficiency, or a problem less severe. Our example sentences: The nurse was able to alleviate his pain when she gave him the medication. The nurse was able to alleviate his pain when she gave him the medication. And next up we have an adjective, responsive. And this describes someone or something reacting quickly and positively, and the ability to respond to a stimulus. Our sentence example is, Claire is becoming more responsive since she received her treatment. Claire is becoming more responsive since she received her treatment. Our next term is Medicaid. Medicaid in the United States is a federal and state program that helps with healthcare costs for some people with limited income and resources. We could say, she is on Medicaid, which helps pay for her asthma medication. She is on Medicaid, which helps pay for her asthma medication. Our next term is backache, and this describes a prolonged pain in the back or spine. Let's take a look at our example sentence. I have been suffering with a backache for the past 2 weeks. I have been suffering with a backache for the past 2 weeks. Our next term is a piece of medical equipment, crutch. And the definition is a long stick with a crosspiece at the top, used as a support under the armpit by a person with an injury or disability. We could say, Mary is on crutches since she broke her hip bone. Mary is on crutches since she broke her hip bone. Coming up next, we have the term therapy. And this describes treatment intended to relieve or heal a disorder. And there are lots of different types of therapy. Let's take a look at our example. Her physical therapy will help her regain her stamina. Her physical therapy will help her regain her stamina. And our final term is a phrase, as fit as a fiddle. And this is a phrase meaning in good physical condition, to be very healthy and strong. Our example sentence is, my grandfather recovered from his illness and is now as fit as a fiddle. My grandfather recovered from his illness and is now as fit as a fiddle. In this English lesson, I will focus on English verbs and phrasal verbs relating to healthcare. In total, there will be 15 terms to learn with pronunciation, definition, and sentence example in 2 tenses. If you follow my channel, you will know I have already published lots of great English lessons relating to medicine and healthcare. Make sure to check out the link for some of those videos on screen right now. This video is great for anyone working in the medical field and wanting to expand and develop their English vocabulary for communication skills. Don't forget to check out the extensive word list in the description for all the English verbs covered in today's lesson. There are lots more verbs relating to healthcare, so if you'd like me to do a follow-up video, let me know in the comments. So if you're ready, sit back, relax, and let's learn some healthcare English verbs like a pro. First up, we have a regular verb, administer. Repeat after me, administer. This means to give medication or treatment to a patient. This may mean by injection, ingestion, which means to eat, application to the skin, inhalation, or other means. Our first sentence example is in the future tense. I will administer the painkiller to the patient by injection. Our next sentence is in the past tense. I administered the treatment to the patient this morning. Moving on, our next term is a phrasal verb, care for. Care for. And this means to do the things that are needed to help and protect a person or animal. It means to look after someone or something. Our next example is in the present tense. The nurses care for the patients in the hospital. Or we could say, I will care for the patient this evening. Next up, we have the regular verb to assist. Assist. And this means to help someone, typically by doing a share of the work. It can also mean being present at an event as a helper. In the past tense, we could say, 2 midwives assisted at the birth yesterday. And in the future tense, I will assist the doctor during her appointments tomorrow. Our next verb is determine. Repeat after me. Determine. And this verb means to ascertain or establish exactly why something is occurring or has occurred by research or calculation. Our example is, the doctor determined that the issue is muscular. The hospital will determine the cause of her illness. Next up, we have a phrasal verb, to pass away. Pass away. And this phrasal verb simply means to die. It is a nice way to say it. Our example sentence is, the patient passed away earlier this evening. In the future tense, you would say, unfortunately, the patient will pass away soon. Coming up next, we have the regular verb to sever. Sever. And this means to divide by cutting or slicing, especially if it happens suddenly or forcibly. In the past tense, we could say, the patient severed her index finger in an accident. Let's take a look at a sentence in the future tense. During the operation, the doctor will sever the nerve. Our next verb is very commonly used in healthcare. Prescribe. Repeat after me. Prescribe. In the context of a medical practitioner, to advise and authorize the use of a medicine or treatment for someone, and this is especially done in writing. We could say, the doctor prescribed some medication for his pain. Or in the future tense, we could say, the doctor will not prescribe any more medication to you. Let's move on to our next term, which is a phrasal verb, to come down with. Come down with. And this means to become sick with a particular illness or complaint. In the present continuous, we could say, I am coming down with the case of the flu. And in the past tense, we could say, all the patients came down with the bad cold. If this is the first time you're visiting my channel, Learning English Pro, you're very welcome. My name is Jer and I'm narrating your lesson today. Make sure to subscribe to stay updated on all my latest videos. Let's get back to our verbs, and next up we have suture. Repeat after me. Suture. And this means to stitch up a wound or incision with stitches. In the future tense, we could say, I will suture your wound for you. In the past tense, we could say, the medic sutured the wounds of the soldiers during the battle. Our next term is the phrasal verb to pass out. Pass out. And this simply means to lose consciousness. And our sentence example is in the future tense. She will pass out if she sees the injection needle. And in the past tense, our sentence example is, after a few minutes, the patient passed out. The opposite of pass out is another phrasal verb, to come to. Come to. And the definition is to recover consciousness. We could say in the past tense, the patient came to after the surgery and was okay. In the future tense, we could say, she will come to in a few minutes. Let's get back to a regular verb with inject. Inject. And this means to introduce a liquid, especially a drug or vaccine, into the body with a syringe. We could say, the nurse injected the painkiller and I began to feel better. Or in the future tense, we could say, He will inject the medicine into the patient's vein. Next up, we have a phrasal verb, to fight off. Fight off. And this means to defend oneself against someone or something by fighting or struggling. So you would fight off an illness or a disease. You could say, the patient has fought off the infection very well. Our next example is, we hope she will fight off the virus in her stomach. Moving on, our next term is the regular verb to massage. Massage. And this means to rub or knead a person or part of the body with the hands. In the past tense, we could say, the patient massaged their head with the ointment. Or in the future tense, we could say, the nurse will massage the patient's shoulders. Next up, we have the regular verb to ache. Ache. And this means to suffer from a continuous dull pain. Our sentence example is, the patient said that her leg aches badly. Or we could say, my back will ache tomorrow if I lift those boxes. In today's lesson, we're going to take a look at some medicine English vocabulary. This will involve looking at the different types and forms of medicine, along with the associated symptoms. Let's take a look at our lesson plan. You'll learn lots of important vocabulary, along with perfect pronunciation and lots of context and information, so you'll really get to know the vocabulary very well. I don't know about you, but I'm ready to start this lesson, so grab a pen and paper, sit back, relax, and let's learn some English on medicine together. First up, we're going to explore symptoms in a question format and have a look at the associated medication that is used as treatment for these symptoms. Our first question is, do you have an infection? Do you have an infection? If you have a bacterial infection, you will need an antibiotic. Repeat after me. Antibiotic. Another type of infection that is common is a viral infection, an infection by a virus. And we use antiviral medication to treat a viral infection. Antiviral. Our next question is, do you have pain or fever? Do you have pain or fever? For these symptoms, you would take a painkiller. Repeat after me. Painkiller. Our next question is, do you have a cough? The word cough has an unusual pronunciation. Instead of a G sound, we have an F sound here. Do you have a cough? And the medicine for a cough has a few different names. It can be called cough syrup, cough medicine, or a cough suppressant. My next question to you is, do you have allergies? Do you have allergies? And for an allergy, we take an antihistamine. Repeat after me. Antihistamine. Let's do that one more time. Antihistamine. Our next question is, do you have asthma? Do you have asthma? The type of medicine used for asthma is a steroid. Repeat after me. Steroid. Let's move on to our next question. Do you have a blocked nose? Or we could say, do you have a stuffy nose? If you have this condition, you will need a decongestant. Repeat after me. decongestant. And a medicine which is in the news a lot lately is related to the coronavirus. And the medicine that is being discussed is a vaccine. Repeat after me. Vaccine. Let's hope that the new vaccine is successful in the battle against coronavirus. If this is your first time with my channel, you're very welcome to Learning English Pro. My name is Jer. Make sure to subscribe and share this channel with your friends right now. I have tons of really useful vocabulary lessons on my channel. Click the link on screen now to bring you to a selection of those, and enjoy! Okay, let's get back to our lesson and let's move on to the next segment, which is different forms of medicine. We will discuss the different ways in which medicine is delivered to the human body. Medicine is often given in liquid form, and sometimes it is given in a syrup. This is a thick liquid medicine that you drink, and it can be sweet. This type of thick liquid medicine is common for symptoms in children, coughs and colds, or for adults with stomach problems. Sometimes liquid medicine needs to be given directly into the body, like into the bloodstream or into muscle. This medicine is usually given through an injection with a syringe. Liquids can also be given directly into the body by intravenous therapy. This is regularly used in hospitals to deliver medicine to patients, and the device used is simply called an IV. Medicine can also be given in tablet or pill form. Lots of different types of medication can be given in this form. And this medicine is usually round or oval shaped. Another type of tablet you may see is a soluble tablet. These tablets can be dissolved in water. The resulting mixture is then drank to cure symptoms. These types of tablets are typically used for painkillers and antacids. The next form of medication we will look at is a capsule. A capsule is a shell which contains medicine. Some people will also call these tablets or pills, and the capsule dissolves and is digested when swallowed. The next type of medicine we will look at is a lozenge. A lozenge is a small candy-like medicine that dissolves in your mouth. Lozenges are usually used to help symptoms in the mouth or throat. Our next type of medicine can be called a cream, lotion, or ointment. And this is a thick liquid medicine that is applied to the skin. Our next type of medicine is drops. This type of liquid medicine is usually used for symptoms for the eyes or the ears. The next form of medicine we will have a look at is spray. This type of liquid medicine is usually applied up the nose or onto the skin, depending on the symptoms. The final form of medicine we will have a look at is inhaler. An inhaler is used to deliver vapor medicine to the lungs. It is commonly used by people who suffer from asthma. Up next, we are going to take a look at the difference between these two terms, over-the-counter and prescription drugs. First up, let's take a look at over-the-counter and what that means. Medicine which is over-the-counter can be purchased without consent from a doctor. Depending on the country, this type of medicine can be purchased in drugstores, pharmacies, or even supermarkets. Whereas with prescription drugs, this type of medicine can be purchased only with consent from the doctor and purchased at a registered pharmacy or chemist. The consent is usually given as a paper document simply called a prescription. In this video, we will dive into the medical field of pediatrics. This is a medical specialty which focuses on the care of children. I will explain this area of medicine to you in simple English with lots of definitions and medical terminology along the way. We will be taking a look at some of the differences between a doctor treating a child and treating an adult and the reasons why this is necessary. Don't forget to check out the extensive word list in the description below and check out my many other English vocabulary videos based on medicine and medical issues. Links for those are on screen right now. Okay, if you're ready, let's get started learning all about pediatrics in English. Let's take a look at our first word in our lesson, which of course is pediatrics. And as you can see on screen, there are 3 different spellings for this. For the duration of this video, we'll be sticking with the first spelling. And let's take a look at the definition. Pediatrics is the branch of medicine that involves the medical care of infants, children, and adolescents or teenagers. In the United States of America, pediatric care is usually available to people until they reach the age of 21. However, in other parts of the world, pediatric care is usually offered until the age of 18. A doctor who specializes in this area is known as a pediatrician. Let's practice this word a few times. Pediatrician. Pediatrician. One more time. Pediatrician. And pediatricians generally work in hospitals and children's hospitals. The oldest traces of pediatric care can be found in ancient India and ancient Greece. But pediatrics as we know it didn't come around till much later. The Swedish physician Niels Rosen von Rosenstein is considered to be the founder of modern pediatrics as a medical speciality. The first generally accepted pediatric hospital is the Hôpital des Enfants Malades, which opened in Paris in June 1802 on the site of a previous orphanage. From its beginning, this famous hospital accepted patients up to the age of 15 years, and it continues to operate as a children's hospital to this day. Okay, let's move on and have a look at the differences between adult and pediatric medicine. And the reason there is a difference is because there is a substantial physiological difference between the body of a child and that of an adult. Let's take a look at a definition of this adjective physiological. This word means anything relating to the branch of biology that deals with the normal functions of living organisms and their parts. And because of children's age, congenital defects, genetic variants, and developmental issues are of greater concern to pediatricians than they often are to adult physicians. Let's take a look at some of these issues in greater detail. Congenital defects can be defined as structural or functional anomalies that occur during pregnancy. These can also be called birth defects, congenital disorders, or congenital malformations. These conditions develop prenatally and may be identified before or at birth or later in life. Genetic variation refers to diversity in gene frequencies. Gene variation can refer to differences between individuals or to differences between populations. Mutation is the ultimate source of genetic variation, but mechanisms such as sexual reproduction and genetic drift contribute to it as well. Developmental issues include delays or abnormal patterns of development in the areas of communication or language, motor skills, problem solving, or social and adaptive behavior. These concerns are usually based on comparison to children of the same age. If this is the first time you're visiting my channel, Learning English Pro, you're very welcome. My name is Jer and I'm narrating your lesson today. Make sure to subscribe to stay updated on all my latest videos. Another important aspect of pediatrics is medication, and a child's physiology directly impacts the properties of drugs that can enter the body. The absorption, distribution, metabolism and elimination of medications differ between developing children and grown adults. And let's take a look at some of the highlighted terminology in screen in greater detail. So first up we have absorption, and this is a condition in which something takes in another substance. So we would say that drug absorption is the process of a drug moving from its site of delivery, like the mouth, into the bloodstream. And many drug absorption differences between pediatric and adult populations revolve around the stomach. Young infants have different levels of acid in their stomachs, which creates a more basic environment for drugs taken orally. Our next bit of terminology is distribution. This describes the way in which something is shared out amongst a group or spread over an area. The word distribution is usually referred to in relation to the movement of goods, but drug distribution refers to the movement of a drug to and from the blood and various tissues of the body, like fat, muscle, and brain tissue, and the relative proportions of the drug in these tissues. The percentage of total body water and fluid volume decrease as children grow and develop with time. Therefore, children have a larger volume of distribution than adults, which directly affects the dosing of drugs given to them. Our next English word is metabolism. Metabolism is the chemical reactions in the body cells that change food into energy. Drug metabolism is the metabolic breakdown of drugs by living organisms, usually through specialized systems. Drug metabolism primarily occurs via enzymes in the liver and can vary according to which specific enzymes are affected in a specific stage of development. Next up, we have elimination. And this word describes the complete removal or destruction of something, or the expulsion of waste matter from the body. And in humans, drug elimination is primarily facilitated via the liver and kidneys. In infants and young children, the larger relative size of their kidneys leads to increased renal clearance of medications that are eliminated through urine. Our next topic of discussion is pediatric autonomy in healthcare. Now, what does the word autonomy mean? Let's take a look at the definition. Autonomy is the capacity to make an informed, uncoerced decision, or it can be called freedom from external control or influence, or independence. Simply put, it's the freedom to make decisions for yourself and your own body. So this word is important when we talk about pediatric healthcare. A major difference between the practice of pediatric and adult medicine is that children in most jurisdictions, and with certain exceptions, cannot make decisions for themselves. The issues of guardianship, privacy, legal responsibility, and informed consent must always be considered in every pediatric procedure. Today we will cover vocabulary related to the anatomy, and more specifically, body systems. Our first words are the muscular system. Repeat after me. The muscular system. In the muscular system, we have muscle. Repeat after me. Muscle. Next up, we have the nervous system. Repeat after me. The nervous system. And in the nervous system, you will find a nerve. nerve. Our next system is the circulatory system. The circulatory system. In the circulatory system, you will find an artery, which takes oxygen-rich blood away from the heart. And you will also find a vein. Veins deliver blood which is lower in oxygen back towards the heart. And of course, our next word is blood. Repeat after me. Blood. And within blood, we find red blood cells. Red blood cells, and these of course carry the oxygen around the body. Also in blood we have white blood cells. White blood cells, and these help fight infection. Next up we have a special image from an electron microscope of a platelet. Repeat after me. Platelet. And these help heal us when we get cut or have scars. And doing all the work in the circulatory system is the heart. Heart. Our next body system is the respiratory system. Respiratory system. And here we have the lungs. Lungs. Also in the respiratory system, we have the trachea. Trachea. Our next body system is the digestive system. The digestive system. And the first part of the digestive system we'll look at is the stomach. Repeat after me. Stomach. This is the large intestine. Large intestine. And here we have the small intestine. Small intestine. And the next part of the digestive system we'll look at is esophagus. Repeat after me. Esophagus. And the last part of the digestive system we'll cover today is the mouth. Mouth. In this week's video, I am covering the respiratory system and lots of additional English vocabulary like different parts of the lungs, medical terminology, verbs, nouns, and lots of medical context for you. I have already published many videos on medical topics, so click the link on screen now to bring you to a selection of those videos. Don't forget to check out the word list in the description below. Okay, if you're ready, let's get started. And the first part of the respiratory system we will take a look at is of course the lungs. Repeat after me. Lungs. And this is the plural form of this noun as we generally talk about them as a pair. And below the lungs we have the diaphragm, and the G here is silent. Diaphragm. Our next body part is the nose, and this is where the air enters our bodies through the nostrils. And behind the nose we have the nasal cavity. And here you can also find the paranasal sinuses. And air can also enter our bodies through the oral cavity. Next up we have the pharynx, which is located at the back of the throat, and this is where air and food enter into the body. Next up we have the larynx, commonly known as the voice box, and when air passes through this, it gives us our voice. And from here, air then passes through the trachea, also known as the windpipe. Let's take a closer look at the internal structure of the lungs. At the carina of trachea, the windpipe branches out into these two separate lungs, the right lung and the left lung. Next up, we have the right and left bronchus. And from these, air passes into the bronchi. And from the bronchi, air then passes through the alveoli. The alveoli are the endpoint of the respiratory system. And this is where the exchange of oxygen and carbon dioxide takes place in the bloodstream. And this covers all the main different parts of the respiratory system. Now let's move on and break down lots of different associated vocabulary you can use when talking about the respiratory system. First up, we have the verb to breathe. This word means to take air into the lungs and then expel it, especially as a regular physiological process. A noun which is often confused with the verb breathe is breath. And this noun describes the actual air taken into or expelled from the lungs. You might have heard someone's breath being described as bad breath. And this means that someone has an unpleasant smell to their breath. Next up, we have the noun oxygen. And this, of course, describes the colourless, odourless gas and the life-supporting component of the air. In hospitals, oxygen is kept in oxygen tanks, and we often talk about oxygen supply, and this means the level of oxygen going into the body. Our next word is the term asthma. Repeat after me. Asthma. Asthma is a condition in which your airways narrow and swell and may produce extra mucus. This can make breathing difficult and trigger coughing, a whistling sound when you breathe, and shortness of breath. Don't worry if you don't understand all these words, I'll be covering them in just a moment. Asthma is usually treated with steroids delivered into the lungs by an inhaler. Let's review some of these words we just saw in that definition. Airways is a noun, and it describes the passage by which air reaches a person's lungs. So it's a synonym of the word trachea or windpipe. Airways. Our next word is the noun mucus. Mucus is a normal, slippery and stringy fluid substance produced by many lining tissues in the body. We also have the word phlegm, which is a type of mucus produced in the lungs and the lower respiratory tract. Let's take a closer look at the pronunciation of phlegm, and as you can see on screen, the PH is pronounced as an F. And we have a silent G, so this word is quite deceptive. Phlegm. Next up, we have the term shortness of breath. And this means an uncomfortable condition that makes it difficult to fully get air into your lungs. You could say the patient is suffering with a shortness of breath. Next up, we have the noun pulmonologist. Now, what is a pulmonologist? This word describes a physician who specializes in the respiratory system. So if you have a problem with your respiratory system, you go to the doctor called a pulmonologist. If you'd like more vocabulary on different types of doctors, check out my video. The link is on screen for that right now. Our next English word is cough. A cough is a voluntary or involuntary act that clears the throat and breathing passage of foreign particles, microbes, irritants, fluids, and mucus. It is a rapid expulsion of air from the lungs. Coughing can be done deliberately or as part of a reflex. The word cough is both a noun and a verb. A noun sentence example would be, she has a cough. She has a cough. Let's take a look at a verb sentence example. The patient coughed a lot this morning. The patient coughed a lot this morning. Our next word is sneeze. A sneeze is a semi-autonomous, convulsive expulsion of air from the lungs through the nose and mouth, usually caused by foreign particles irritating the nasal membrane. And like the word cough, sneeze is both a noun and a verb. So again, let's have a look at two separate sentence examples. Our noun example is, a sneeze can help clear your nose. A sneeze can help clear your nose. Our verb example is, she sneezed a lot this morning. She sneezed a lot this morning. Let's move on to our next term, which is chest infection. A chest infection is an infection of the lungs or large airways. Some chest infections are mild and clear up on their own, but others can be severe and life-threatening. The main types of chest infection are bronchitis and pneumonia. Most bronchitis cases are caused by viruses, whereas most pneumonia cases are due to bacteria. These infections are usually spread when an infected person coughs or sneezes. So just to reiterate, bronchitis is caused by viruses and pneumonia is caused by bacteria. If this is the first time you're visiting Learning English Pro, you're very welcome. My name is Jer and I'm narrating your lesson today. Make sure to subscribe to stay updated on all my latest videos. Let's move on to our next word, which is the verb to inhale, and this means to breathe in. Then we have the opposite of this word, the verb to exhale, which means to breathe out. An example sentence for inhale is, we inhale oxygen all the time. And for exhale, the patient exhaled deeply after the procedure. Our next two words are very similar to inhale and exhale. The noun inhalation means the action of inhaling or breathing in. And of course, we have the noun exhalation, which describes the action of exhaling or breathing out. Let's take a look at some examples. You need to take a few deep inhalations. The patient's exhalations are very raspy. Today's crucial lesson is about first aid English. We'll cover essential phrases you need to know in emergency situations. And all the phrases covered in today's lesson are waiting for you in the video description if you want to follow along or revise. This lesson will be a lifesaver, so let's get started. In an emergency, asking the right questions is vital. Here are some key phrases. Are you okay? Where does it hurt? Can you breathe normally? Practicing these questions can help you assess the situation quickly and efficiently. Next, let's learn how to offer help. Being able to communicate effectively in these moments is crucial. I know first aid. Can I help? Stay calm. Help is on the way. Keep the wound clean and covered. These phrases are essential for providing immediate assistance and reassurance. Sometimes you may need to seek help from others. Here's phrases for what you could say. Call an ambulance immediately. We need a doctor. Is there a first aider nearby? Knowing how to call for help effectively can make all the difference in an emergency. That's it for our first aid English lesson. Remember, these phrases could be crucial in an emergency, so practice them well. Today we're diving into essential English phrases you might need in a hospital setting. Whether you're traveling, working, or just expanding your vocabulary, this lesson is for you. All the phrases covered in today's lesson are waiting for you in the video description if you want to revise or follow along. Also in the video description is the link to my playlist on medical English, full of lots and lots of useful lessons. So let's get started. First, let's cover greetings and basic questions. In a hospital, you might need to ask for help or directions. Someone might ask you, "How can I help you?" We could respond, "Hello, I am looking for the emergency department." Or we could say, "I need to see a doctor." Or maybe you're visiting someone. "I am visiting my aunt. Could you tell me her room number?" Practice these phrases to feel confident in asking for initial assistance. Let's move on to phrases related to describing symptoms. A doctor or a nurse might ask you, "What are your symptoms?" They could also ask you, "How are you feeling?" "I have a headache." "I feel dizzy." "My stomach hurts." Being clear about your symptoms will help medical professionals understand and assist you better. It's also important to understand common responses from medical staff. You may be asked some of the following things. Please fill out this form. Do you have any allergies? Follow me, please. Knowing these phrases helps you follow instructions and respond appropriately. In emergencies, knowing a few key phrases can be crucial. Call a doctor. It's an emergency. I need help immediately. These phrases are vital for urgent situations, so remember them well.